So today we're going to be hanging a primary and a secondary bag for IV. So we've got to gather all of our supplies. So we've got our primary bag, our secondary bag, we got our primary line and our secondary line, and then we're going to have a syringe to do our flushes to make sure that our IV is patent. And then we also brought in supplies to if we need to do a dressing change on the IV. So before you come in, you always want to check your doctor's order. So it looks like the doctor ordered cefalozolin via IV piggyback. So we're going to have our cefalozolin and we're going to hook that up to our secondary bag. And the doctor also ordered us to infuse a primary bag, 500 milliliters. So we're going to do that over 8 hours. All right, so first we're going to come in, we're going to knock, we're going to do our overriders. So we're going to close the door for privacy. All right. And then we're gonna make sure our bed is locked, brake is on. We're gonna raise it to a comfortable working height. Then you always wanna put the side rail down. You don't wanna break your back. All right. And so then I would normally check my orders against. All right, so first we're gonna wanna check our patient. So if I can have you verify your name and date of birth. All right, and we're going to verify that against our doctor's order to make sure that we have the correct patient. We want to make sure we have the correct patient, correct medication, correct way that we're going to administer it. So we're going to be doing IV piggyback and a primary IV bag. So then we're going to go around and we're just going to. All right, so first we're going to want to check our patient. So if I can have you verify your name and date of birth. All right, and we're going to verify that against our doctor's order to make sure that we have the correct patient. We want to make sure we have the correct patient, correct medication, correct way that we're going to administer it. So we're going to be doing IV piggyback and a primary IV bag. So then we're going to go around and we're just going to assess the IV site that's already in place. All right, so we're going to assess our IV site before we actually start to infuse any medication. So we want to look for any edema, swelling. We want to check the patency of our IV and make sure that it is flowing properly before we instill any medication into it. I'm going to wash my hands and put on my gloves. Extra large gloves. Okay. All right, and so we want to make sure there's no redness, no edema, and then we're going to flush it and make sure that it's patent. So normally we're going to do a friction scrub on our IV catheter here. And so we're going to scrub it for 15 seconds to make sure that we kill any of the bacteria that's growing on it. And what we're looking for whenever we're doing a flush is we want to make sure that it's not infiltrated into the patient. So we want to make sure that we're not going to see any coolness or any swelling that occurs whenever we do our flush. And then when you're doing a flush, you want to pulsate it so you can kind of mimic the natural beat of the heart and the flow of the blood that would go through. So then we're just going to check it. And we'll just do about 5 mLs just to make sure that it's patent. It looks good. So now we can go ahead and continue to set up our IV. So first we're going to set up our primary bag. So when we go to hang our primary bag, we're going to make sure to prime all of our line. So first we just have to get it open here. And you want to make sure you try not to get any of your catheters to hit the ground because you don't want to introduce any harmful bacteria into the patient's IV site because that's typically not good. So we are going to pull this up. And we're going to spike it. And we can hang it here. All right, and then you want to make sure all your clamps are locked, which they're not. Okay, and then you want to run the line, and you don't want to open it all the way, but we can open it a little bit until we see our saline start to infuse, and you want to make sure that this chamber here has some liquid in it so that you can see your drip rate. And then we're just going to run our line until we see it come out. It's running here. Here we go. And you want to make sure to get all the air bubbles out of your line. All right, so that looks pretty good. We got most of them out, just a few little air bubbles isn't going to hurt anybody. So now that we've got our primary hooked up, now we can go ahead and hook it up to our patient. All right, so with our clamp locked, so we're going to go ahead and we're going to scrub our catheter tips again. We'll do that for 15 seconds on each one. Okay. And then we're going to go ahead and hook it up to our patient here. All right, now that we've got it hooked up, now we can hook it up to our pump. So we're going to need our key. So this is our key to unlock our pump. So you just push this down into here. And then that'll open our pump here. There we go. Okay. And then we just have to program our pump. So we're just gonna do general. Okay. Oh, just kidding, do setup. Okay. All right, so our doctor's order said that we're gonna infuse this 500 ml bag over 8 hours. So that's gonna give us a drip rate of 63 milliliters per hour. So we're just gonna set that up. So we got that. Our rate, we'll do 63. And our volume to be infused is gonna be what's in the bag. So you wanna set it up a little less because you want it to alarm us before it runs out. So we're gonna do 450 milliliters. Okay. Okay, and now we're just going to remove all of our clamps. So we want to make sure that's open, and then we're going to make sure this clamp is open. And then you also got to make sure that the J-loop clamp is open here. Okay. Now that we've got it running, we should start to drip from our primary bag. Okay, so it's dripping, so we just want to make sure there's no kinks in the tubing. We got all of our air out, and so now we've got our primary hooked up to our patient, and they're good to go. So now we already double checked our doctor's order. We did our 3 med checks, and so we've got our, all right, so for our secondary bag, we're gonna have to reconstitute our medication. And so it looks like we've got 5 mLs. We already did the math. So we would clean the top of our vial here. And then we're going to inject to get a new needle. So we want to draw up our medication here. And so we're gonna pull all of this up. The doctor ordered for 1 gram, which is the whole vial. So now that we've got all of our medication pulled out of our vial, we're gonna go ahead and we're gonna insert it into our secondary bag. Okay. Okay, and now that we've got our secondary bag primed with its medication, we're gonna have to hook it up to our secondary lining. So we'll go ahead and open up this. And we're gonna need this tie because with the secondary bag, you always wanna hang it lower than your primary bag. Get all this hooked up. Okay. And we can go ahead and spike our bag. Okay. Make sure our clamp is closed, which it is. And then we'll take our, so we're gonna hang our secondary bag. So you always wanna put the secondary bag higher than the primary. So that's why they give us this extra length that we can lower our primary bag down. So we'll go ahead and hook that up. And the reason we do that, we want to infuse all of our medication that we're trying to administer to the patient. And then after the medication's infused, it can go back to the primary bag and they can continue that. So now that we got our bag hooked up, we're gonna go ahead and prime it. Okay, so now we've got it primed. Now we can go ahead and hook it up to our line here. Okay, so now we've got our secondary line hooked up, and now we just have to program it into our pump. All right, so we're gonna stop it for just a second, and we're gonna review and program it, and then we're gonna program a secondary bag. Then we got our secondary bag. Okay. And for this one, we're gonna do, we'll say 100 milliliters per hour. We'll do 100 milliliters per hour. And our volume to be infused is gonna be our 500 ml bag that's reconstituted with our medication. And then we can just start it again. Okay, and then we just gotta make sure that our clamp is open on our secondary. And now you can see we've got drips coming from the secondary bag, and the primary is just it's just sitting on standby until the secondary bag's done infusing.
Knock, come in, I've checked my orders. I'm gonna do a IV push with 1.5 mLs of acetaminophen, PRN, every 6 hours. I'm gonna come into the patient's room. Hello, my name is Bailey. I'm a student vocational nurse at Weatherford College. I'm here to give you your pain medication that you requested. Can you confirm your name and date of birth for me? All right, I would scan my bracelet. Skylar Hansen, 9/11/2008. And do you have any allergies? No? Perfect. All right, I'm gonna come around over here to my IV. And can you tell me what your pain is on a scale of 0 to 10? A 7? Okay. And where are you having pain at? You have a headache? All right. I'm gonna lower my bed rail. Our fluids are finished running, so we disconnected the line. So I'm gonna clean our hub. We're gonna let that dry. I'm gonna do my third med check. So we have 1.5 mLs of acetaminophen every 6 hours for Miss Skylar Hansen. We're gonna double check that in our orders. 1.5 mLs acetaminophen every 6 hours, PRN. The thing we're gonna do is flush with 5 mLs of saline. Make sure that our IV site is still compatible and patent. All right. Now we're gonna take our medication and administer. I'm gonna watch for any redness or swelling around the IV site. Once we flushed or pushed that, we're gonna push the rest of our saline. 5 more. All right. Now we're gonna clean our hub again and replace the cap. And then now I'm gonna do a dressing change while I'm here. Okay, we're gonna do our dressing change now. You're gonna need a Tegaderm, some clear tape, and a marker or a pen to write your initials, date, and time. So when you take the dressing off, we're gonna make sure and take it off very carefully. This is not the typical dressing you would see. We're gonna throw that in the trash. While we're here, we're gonna just examine the insertion site, so make sure there's no edema, redness, or swelling. We're gonna take our Tegaderm, and we're gonna place this, making sure that our hub is not covered. We're going to save this. Okay, then you just peel all the way around. All right. I'm going to take a piece of tape and we're going to cut it or tear it down the middle. That way we can place it underneath to secure the hub. And then you can just wrap this around here. I got my tape a little too long. Okay, now we're gonna place our label on it. This mannequin's skin is very slippery. It's all coming off. Okay, we're gonna put our name, initials, date. Say the 27th, 28th, 27th, and then the time. So 12:43. All right, and that is our dressing change. So we're going to raise our bed rail. I'm going to reassess my patient in 30 minutes to make sure that their headache has went down and their pain levels decreased. We're going to make sure our bed's locked and the call light is in place. I'm going to dispose of my syringes in the sharps or in the trash can, and that is it.